Excuse me. Okay, give everyone a couple more seconds before we get started.
Yep.
Okay, cool. I guess let's go ahead and get started. So, greetings everyone, and thank you for spending time with us today. We are with Accelirate Incorporated. We are an automation and AI consulting firm focused on making these technologies practical and scalable for organizations. We help bring together people, agents, and robotics into one coordinated environment that improves operations and strengthens compliance. We have been doing this since around 2016, and we're a top-tier UiPath partner. While we work across several industries, we've built a dedicated healthcare and life sciences practice because we understand how specialized and regulated this space is. With that said, my name is Jonathan Leon. I'm a senior solution process architect. Been with Accelerate for a little over 2 years now. Here at Accelerate, I specialize in working with clients as a business analyst. So I'm working with teams and their different leads, identifying opportunities for automation, working on planning that out and understanding all the details, and then just really seeing it through the entire life cycle. Prior to joining Accelerate, I do come from the healthcare industry on the IT side. I've been in that for 20 years, supporting revenue cycle departments. So I do understand a lot about operations and technologies used in that area. Really excited to be doing the work that we're doing here, and I'm excited to show you this that we have here. So alongside me today is Fergans. If you want to go ahead and introduce yourself, my man.
Yeah, sure, of course. Hi, my name is Fergan Smildert. I'm an automation technical lead here at Accelerate. I've been with Accelerate for about 6 years now. A lot of experience in the healthcare industry and finance industry, so work with different teams to make sure we bring you the best technology available, especially from UiPath and other technologies that we do have. So I'm really excited today to show you what we have, the platform that we have built. And Jonathan, I'll kick it back to you.
Thank you, sir. All right, let's go ahead and share what we have. Okay, so before we talk about technology, we want to acknowledge something that everyone in this space already feels. Denials are not new. What has changed is the pace, the volume, and the complexity. Denials are no longer a workflow problem, they're a scale problem. Most health systems are not struggling today because they lack expertise. They're struggling because they cannot scale expertise. Appeals require clinical judgment, they require payer nuance, they require time, and as volumes rise, excuse me, recovery only scales if headcount scales. So it's not sustainable. Today, what we want to show you is a different model. Jumping ahead. All right, so let's ground this in reality. An appeal today requires reviewing clinical documentation, interpreting payer language, drafting a structured letter, validating compliance, submitting through varying payer workflows, and following up. And every payer behaves differently. For frontline teams, this means long hours and backlogs. For leaders, this means trapped revenue and unpredictable recovery timelines. Billions in recoverable revenue sit in denied claims across this industry, not because it cannot be recovered, but because the process cannot scale. This is where most automation efforts fall short. All right, cool. Healthcare has already made progress in automation. We've moved from a fully manual workflow to rule-based RPA. That helped eliminate repetitive tasks, but appeals are not repetitive. They require interpretation, context, and clinical reasoning. RPA automates tasks, it doesn't make decisions. Now, standalone AI can draft content, but it does not manage workflows. What we need is an orchestration. Orchestrated agents that classify, that decide, that act, follow up, and even learn, all while keeping a human in the loop for validation and governance. This is not about replacing clinical review. It's about removing the administrative friction so clinical expertise can operate at scale. What used to take 4 to 6 hours in a manual function has now moved to a 30 to 45-minute cycle with validation in ACT. What we're showing here again is just like the breakdown of that manual workflow. This is just the denial process in a linear fashion. We've just kind of called out the steps along the way. In reviews of several clients and averaging it out, it takes an average of 4 to 6 hours for an appeals nurse to go actually up until the denial appeals submission phase. So doing that at the initial identification, the analysis of whether to deny or not, the type of clinical documentation that needs to be reviewed, how to gear the appeals letter towards that specific reason, and then even drafting and redrafting. Like I said, 4 to 6 hours alone. As mentioned with RPA, those very rule-based processes or steps, RPA has been able to provide a lift in those areas where it's very if-then type of rules. So your identification. So if we're seeing certain ANSI codes, then it would mean this is a particular internal denial reason. It's been very efficient there, but when it comes to actual data analysis or reviewing that clinical documentation, it's very difficult for something like RPA to lend a hand or assist with. However, including RPA, we can see the time to produce that letter has come down from anywhere from 2 to 3 hours. But the great spot is when incorporating those agents, so that AI for data validation and reasoning, you can see here we've taken that letter, that process down to a 30 to 45 minute for just that letter generation. Now we can even take it further and go into the submission steps and even follow-up steps. So you still have your RPA to do those very rule-driven steps, go collect information, some very rule-based decision points. But then when it comes time to like data evaluation, so we've classified the denial type, we have all this clinical data, draft a letter. That's where you've now given AI the information to go ahead and properly decide how that letter should work or look. At the same time, the additional contextual information you're giving it is things like payer guidelines, best practices. It's a set of defined rules that we give the agents to properly think and act as an appeals nurse to get to that letter drafting. So using that technology in that orchestrated fashion, it's drastically reducing time to create this letter. And then always, as mentioned, we have the humans there to really validate, to give guidance, and to go ahead and still be that last proof or that last okay, that gatekeeper there. I'm going to go ahead and kick it off to Fergens to discuss the next slides here.
All right. Thank you, Jonathan. So from a technical standpoint, what makes this platform different is basically orchestration. It's not just a bunch of bots running independently. It's a coordinated workflow across agents, RPA, and human validation. If we think of this process as at a high level, first the denial is classified, and then we have relevant information extracted from clinical documentation. The supporting artifacts, we normalize them. That way, across the process, we understand exactly what's going on. And then at the end, we have an appeal draft that's generated. And then once that's generated, a human would have to go ahead and validate that. And in the case, the process continues through submission and response tracking. So each component that we have here, they have defined responsibilities. Agents, they normally handle reasoning and contextual analysis. RPA processes normally handle system navigation and data retrieval. And then human at the end, they are in control for providing validation and approval. And we're not trying to replace any existing system. What we want to do is this. We want to make sure it integrates directly with any existing EHR or RCM or any payer portal. Basically, what we want to do is orchestrating everything around them. Every action that we take, we log them. Any artifacts that we have, they are traceable, and any output that we provide, either from an RPA or from agent, they are basically auditable. So at the end of the day, we can know exactly what's going on, and nothing we do will be finalized unless we have human validation or approval. So from a governance standpoint, it's a controlled automation. It's not any sort of independent AI decision engine or anything. If you could go to the next slide, please, Jonathan.
Yes, sir.
Yep. And what you're seeing here is not just speed. It's basically a reallocation of effort. In a traditional model, like you'll have a nurse that spent 3 or 4 hours gathering documentation, reviewing denial rationale, or drafting language, formatting letters, and navigating through submission requirements. So basically, what we have here is we have a significant portion of time um, just allocating to do an administrative task. In this model that we have, the nurse, they'll basically receive a structured draft. The clinical documentation, they've already been analyzed. The denial reasoning has already been interpreted, and payer specific nuance has been incorporated. So the nurse, their role shifts drastically. So it shifts from drafting to basically validating and strengthening the letter. Instead of building an appeal letter from scratch, basically what they have to do is applying clinical expertise and pre-structured foundation. Normally, a manual draft and manual review takes about 225 to 250 minutes. But with the AI draft and then a manual review, that's about 30 to 50 minutes. What remained constant is clinical authority. What changes basically is the administrative burden. This is about preserving clinical judgment, reducing burnout, and shifting time towards clinical decision making rather than administrating tasks. And Jonathan, I'll kick it back to you for a quick demo of what we have here.
Yes, sir. Okay. So what we're going to do is jump into the solution that we have surrounding this process, and really we're going to demonstrate everything that we've talked about here. So what we're showing at the moment, this is what we're calling our denials intelligence platform. Now, although we're looking at an application, this is something that is not meant to replace any existing applications that you all have. So any EHR platforms, any third-party applications, any billing systems, we're not asking to replace any of that. What we're saying the solution can do is work on top of that and work alongside it. As you're seeing, we have data here. This was data that was brought into from our automation. So we scoured those different applications for those for those accounts that were flagged as a denial received. It was ingested here. It's already been processed. Our letter has already been started. So I'll go ahead and walk through what the future state workflow could look like for your organization, incorporating this platform that we have designed here. So at this point, this is going to be now like the starting point for your appeals nurses day. Today, they're going to, let's say, log into a billing system or your EHR. They might have a particular work queue that they go to, and it will show newly entered denials. At that point, they'll have to review some of the ANSI codes, review some of the documentation received to start painting the picture as to what the denial reason is. From there, they'll have to now scour and navigate the different points of documentation to understand what happened from a clinical perspective. Why did the patient arrive? What was their treatment plan? How did they recover? Any kind of lab results or anything. All that has to be navigated and reviewed so that they can understand what took place and then now have the idea of how they're going to approach their letter. With this future state design, the moment you open up the application, as you can see here, we have open cases. These open cases signify letters that have already been drafted and are ready for a clinical nurse's, an appeals nurse review. So what the day would look like is they're going to go ahead and open one of these cases, let's say. The case now, once we're in this view, this gives a little more detailed view of that exact case or that account, let's say. So we have any information that we brought in from these applications. For these purposes, we brought in some high-level patient details, including their member ID and information, and then we brought in some claim detail, denied amount, paid amount, and all that. We can present here any data that is being passed through this automation. So if there is any other fields, any other values that are important to you, we can easily bring that in and display it here. Aside from that, what we're showing on the right-hand side is kind of like our audit trail, like Fergen's mentioned. So this is showing what has taken place with this account, the type of automation or technology utilized. So we have here an automation that initially went and retrieved all the patient details from the EMRs or other applications. An agent was handed that information, and then it actually validated it. So it reviewed those ANSI codes. It reviewed what was received by the payer, and it now classified it as a particular internal denial reason. It moved on to the next agent for a decision review to, is it an appealable or no appeal? Is it within limits of those denials to be appealed? And if so, let's go ahead and start preparing that clinical packet. So as we see here, all this took place, and now it's asking for an action at the review draft letter. As we're seeing here, this is the link that's going to take us to review that draft. So I'm just going to go ahead and click on that. And now this is where the appeals nurse would go in and review what the AI has generated, and then modify, accept, reject, just really put in their feedback there. With what we're showing, this is completely customizable. So we can follow any practices you have, any standards you have, any templates that are needed. It can be by payer, it could be what's best practice over the organization. So here we have the flexibility to go ahead and draft this letter as your teams are currently doing. So in our draft here, we have this one going out to United Healthcare. We put in some of that patient demographics, that initial information that's collected from your different from systems of record. And then now this comes the letter that has been appealed. So we have our introduction, we have our clinical summary, we have our primary diagnoses, the treatment plan. So this is all, again, just that picture that the AI has understood, drafting that letter so that we can properly appeal this denial here. At this point within this section here, since it is a text box, we can go ahead and remove, modify, adjust any of this text as needed. But if we feel all is well and we can continue moving forward, we have options down here that are a way of kind of communicating to the automation for next steps. So let's say we've already made adjustments, we feel this letter is ready to go, and it's one of the payers that we do have continued automation for submission. We can go ahead and click the submit to payer option and then approve it. And that's now going to tell the automation, you're good to go with this appeal letter. You're good to create that packet and now navigate to the portal to actually submit this electronically. If for some reason it ends up being one of those mom and pop payers that are just seen here and there, and this has to be something that needs to be printed and mailed out, we have that save option that we can go ahead and select. Again, all these names and labels you're seeing are completely customizable. So in this scenario, we just said save is how we're going to engage the print function to go ahead and print this out and then handle that manually. Request changes, we can kind of kick this back if we want to send this off to maybe, let's say, anyone else for additional validation. Let's say a provider, we want their input there. We can go ahead and select that option to route it to someone else internally for review. So once we've gone ahead and submitted, it's going to kick the automation to go through those steps, go through those phases. As it is submitted, it will, for instance, I know like United Healthcare, let's say, when the packet has been submitted, they have like an internal, it's like a tracking number that can be collected. The automation would scrape that information as well. It will retain it and then put it back into your EHR, let's say, or your billing systems. That way, we're also updating those applications, ensuring that the most recent information is maintained, and anyone navigating or looking at it, the information there can see where these accounts are and in what space. We also know once after submission, there is that waiting point. At times it's 30, 45 days or whatnot. So we can build in those rules within the automation to say after a given time frame, let's go ahead and now do a follow-up to see if there's any additional information that we maybe need to provide, or there's feedback that we need to bring back in. I'm going to go ahead and just fast forward and say that we've already have a submitted appeal. And it's now in another user phase where there's a response that has been provided. So the automation was able to retrieve a response. So we're going to go ahead and open that and see what that message was from that payer site. And here as well, we've decided to bring in some important information like the outcome, the original denied amount, and what was approved based on that outcome, and then any kind of notes or additional comments that were made there. In this case, we see that an outcome overturned was visible there, and they're gonna pay the full amount with any additional comments there. Now, this again is not the source of truth, so we want to make sure that this gets posted back. So we have the ability to just go ahead and click that submit button to ensure that this comment is now spread out through those different applications. So again, the loop is closed completely wherever these accounts are managed. So with this, what we're showing is we have the orchestration of different technologies. We have RPA doing the retrieving of information, doing the system navigation, doing the collection of data. We have it now passing it over to AI to do that analysis, that evaluation, and decisioning. But then we still have those stopping points where we're allowing the teams to really be that last validator, giving it the go, no go to move on forward. I'm not sure if I mentioned this earlier, but this is an option that we have to really just make this space a denials appeal space. However, this solution or this platform works without this user interface. I understand it can be difficult to say we have to access another application to do a workflow. However, what we're doing here is visualizing the automation that's happening behind the scenes. If it's preferred to remain within the applications that you have, we can still have the automation running behind the scenes and still bring these decision points forward to your teams via other manners. So we can save files in particular locations, we can trigger emails, we have ways of communicating and interacting with teams if this seems like a bit much. However, with this, we can make this space unique to your organization, unique to this process, bringing forward all appropriate and valid information. And then since it is all passing through here, it's fully auditable. And then after time, we can now start trending. We can start getting some metrics on where we're seeing any kind of trends happening, or really get a clear picture as to what's going on. So what this means is we're now saving time for your team members. As mentioned before, they're taking, let's say, within an 8-hour time frame, they can maybe get 2 appeals letter drafted. By having this process in place, they can be validating these letters and then now focusing on other matters that really make benefit of their clinical expertise. Over time, they can now become almost like the trend analysis. The analyst. They can really start seeing what's going on in this picture because the AI is pointing out additional information to the forefront. So they can maybe start taking information back to the units and start really maybe giving some education to those areas that could be causing some denials, or so now they can kind of work on actually preventing these denials from occurring in the first place. So with this solution, we're really giving power back to the organizations. We're giving much needed time back to the teams, and then we're giving the organization, I guess, an opportunity to really increase their potential for appealing these denials. I think that's what I have there. I don't know, Fergus, is there anything to add to what we have, or I think
Yeah,
we're
I think
good.
I think you kind of covered everything here with this denials that we have. So we have a few cases here. So some of them are they've already been the letter have already been drafted. So all we need is the nurse to go ahead and review it and put their touches in it. So the AI model will go ahead and generate that with its own language, but the nurse sometimes they want things to be, in a certain way, so they'll just have to slightly modify it.
Yep, of
Um,
course.
but but yeah, overall you covered pretty much everything. Once this is approved, all we need to do is basically go ahead and submit it through the portal directly, as you mentioned earlier. But in some rare cases where we have to go ahead and print this out and mail it directly, we're allowing them to do that as well. So
Actually, wanted to touch on something else. I know we talked about the design being modular and scalable. So I could just quickly show something with that regard. The way we've designed this, as you see here, we have our different phases and stages. If we were to implement such a design within your organization, I understand there could be some hesitation. We don't need to go big bang. We can take this automation and break it up into these sections as you're seeing here, utilizing the data, of course, within the organization, but we can accomplish just a particular portion of the workflow if needed. It's a great way to maybe do like a proof of concept. So let's say we just wanted to try out the letter creation agent. We would obviously need the data. So let's say you're giving us your denial of admission type of accounts. We just want to focus on maybe United Healthcare. So you would give us information to that. We can pass that through our AI agent, and then draft that letter for you. I can say with certainty that when we've started that with previous clients, they have given us up to about 96% of their clinical denials. And the only reason why it's only 96% is because the 4% that we're not touching are those few and far between type reasons. But with the 96%, we're covering the majority of what they receive. I can tell you a team of 12 appeals nurses that has averaged about 550 appeal letters a month. With this solution in place, they're now over 1,000 letters a month. So there is a ton of value that can come from this. And then once we have this, let's say, set in place, we know that there's trust there. We can gladly move on to different stages to even expedite the way the data is moving through this workflow. So I hope we gave you enough information to show you what we have here. We would definitely love to talk to anyone some more about this, see how we can get something going within your organization. If you'd like to have any further discussions, have any other questions, feel free to reach out to us. We are Accelirate Inc. Feel free to reach us out on LinkedIn as needed, and it would be great to be able to help anyone out here. So thank you all for your time today. Hope you have a great one, and take care.
Hey, thank you, everyone.
Bye, everybody.